Hello, I'm Matthew Rothstein, Deputy County Administrative Officer for the County of Lake, and I'm here with Dr. Mollie Charon, a family doctor and infection preventionist who's helping the County of Lake in our COVID-19 response on behalf of the Health Services Department. Dr. Charon, thank you very much for your time today.
Thank you.
Why are you convinced that the COVID-19 vaccine is safe?
Because I have reviewed the studies and the safety data that have been published about the vaccine, as well as the extensive process by which the safety of the vaccine was reviewed by many governmental entities, as well as the World Health Organization. And I think that this is a very exciting moment in terms of being able to say that we have something that is not just effective, but safe.
What would you advise a medically vulnerable family member concerned to take the vaccine?
I've advised all of my family members, including my medically vulnerable family members, to get the vaccine as soon as they are eligible, as long as they do not have any contraindications.
And what about people that are otherwise healthy but have a history of allergic reactions or may need to carry an EpiPen?
That's a really good question. So for persons with a history of an allergic response, as long as the vaccine is not contraindicated for you, please know that it should be safe. So there are protocols in place for some additional TLC, but as long as you don't have a contraindication to the vaccine, even with a history of certain types of allergies, the vaccine should be very safe.
Why is it so important that healthcare workers are prioritized with these first doses of the vaccine?
This is about stabilizing our healthcare delivery system for everyone. The United States has lost at least 1,700 healthcare workers to COVID. And we need to make sure that our healthcare workers are safe in order to ensure that our healthcare system is stable for delivery to healthcare for everyone. That is why healthcare workers are prioritized first. It's really important when we're talking about healthcare workers to recognize that it's anybody in the setting to keep the setting moving. It's not about anybody in that setting being more important than anyone else, because we value human life across the board. The focus on the healthcare workers is anybody in the setting, whether you are the intensivist who is helping to make sure that the ventilator is just right, or you are the nursing assistant. If you need to be in that area, your immunization is prioritized equitably, because this is about stabilizing the system and it is about equity. It is not about hierarchy.
What are your hopes regarding how this vaccine can affect our future?
So my hope is that this time next year, we are able to spend the holidays with our families, with persons who may not survive otherwise, and that we are at a place where we are able to move forward with the people we love, who we've been able to keep safe during this incredibly difficult time. And this vaccine is part of our survival plan.
Dr. Charon, thank you so much for your time. We appreciate your answers and the true care that you have for the Lake County community.
Thank you so much. Wishing everyone a safe, healthy, pleasant holiday. Please celebrate safely and take care of each other.